So mouth care is defined as the scientific care of teeth and mouth, wherein it aims to prevent spread of infection, thus provide comfort and promotion of health to the patient. And the purposes of mouth care are: maintain the healthy state of mouth, gums, teeth, and lips, to remove food particles from around and between the teeth, to remove dental plaques, to prevent sores and infections of the oral tissues, to prevent mucous membrane from becoming dry, to stimulate appetite, to relieve discomfort resulting from halitosis, and to enhance the client's feeling of well-being. First, identify activity ordered. Good morning, ma'am. I am Rachel May Morales, ma'am, and I'll be your student nurse for today. Before I get started, ma'am, may I check your wristband, ma'am? Okay, so I see here Crystal and Batalan, and a date of birth which is March 4, 2002. Next, determine whether the patient has dentures, bridgeworks, and partial plates. Next, assess the patient's general oral health, including the presence of gag reflex, condition of the teeth, gums, and mucous membranes. If the patient has dentures, examine the mouth with or without dentures. Next, obtain needed supplies. So we have here our suction machine, a cup of water, a mouthwash, an MSS basin, dental floss, lip balm, our syringe, a toothpaste, and a toothbrush. Then we have here an alternative to potted tongue blade. We have here popsicle sticks, then a pitcher of water, our face shield, a pair of clean gloves, waterproof pad, and a towel or face towel. And then wash hands. We already identify our patient. Identification of the client is important to prevent negligence through giving wrong procedure to other client. And next, provide privacy, because hygiene is a personal matter. Next, position the patient in a side-lying position, with head turned to the side, if possible with head of bed down. I'm going to position you, ma'am, in a side-lying position. Alright, Miss Batalan, I'm going to turn your head towards me. Setup suction. Attach suction tubing and tonsil tip suction, and then check suction. And now, let's then mask, face shield, and clean gloves. Place the waterproof pad and then the towel under the patient's cheek and chin. Okay, ma'am, I'm going to place a waterproof pad, ma'am, on your chest. And a towel, ma'am, on your cheek and chin. Then, place the emesis basin under the chin. I will take off your eyeglasses, ma'am, for a while, and then I will place an emesis basin, ma'am, under your chin. Next, moisten toothbrush and apply small amount of toothpaste and use soft brittle toothbrush. Next, brush the teeth, holding the bristles at 45 degrees angle to the gum line and using padded tongue blade or bite block to hold the mouth. I will now start brushing your teeth, ma'am. Next, brush the biting surface of the back teeth by holding the brush bristles straight up and down to the teeth and brushing back. Next, gently brush the patient's tongue. Next, draw about 10 ml of water wash into the syringe. Inject it gently into the mouth. Allow fluid to drain into the basin or suction as needed. I will now rinse your mouth, ma'am, and then I will use suction, ma'am. Provide denture care if necessary, but our patient does not have denture. Clean the tissues in the oral cavity using the following: foam swabs or a moistened gauze square wrap around the tongue blade. And then use a clean swab for each area of the mouth. I'm going to clean the tissues, ma'am, in your mouth, including the roof, the cheeks, and the gums, ma'am. Next, remove the basin, dry the patient's face and mouth, and then apply a water-soluble lip moisturizer. I will now remove the towel, ma'am. And then I'm going to apply lip moisturizer, ma'am, in your lips. And then reposition patient as needed. Now let's change your position, ma'am. After that, inspect teeth, gums, and mucous membrane for cleanliness. And then inspect for abnormalities such as bleeding, inflammation, hydration, and infection. And then observe the patient discomfort and gagging during the procedure. And after that, remove gloves and perform hand hygiene. For our documentation, document the following: oral care was given, patient's response, and any abnormal findings and nursing interventions. Good morning, sir. This is Rachel May Morales, your student nurse. Can I come into your room, sir?
Yes, come in.
Before I get started, sir, may I check your response, sir? Can you please state your full name, sir, and your date of birth?
I'm John Paul Morales, December 12, 2000.
Sounds great. Identify activity ordered. Next, assess patient's capabilities to assist with oral care. And then, determine whether the patient has dentures, bridge works, and partial plates. Next, assess the patient's general oral health, including the presence of the gag reflex and condition of the teeth, gums, and mucous membrane. If the patient has dentures, Examine the mouth with or without dentures. After that, assess the patient's usual oral care, including cultural practices. After that, determine assistance needed and obtain needed supplies. So we have here an emesis basin, a toothbrush, a dental floss, toothpaste, a cup of water, our face shield, face towel, and a pair of clean gloves. And then, wash hands. So we already identified the client and explained the procedure. Now, let's provide privacy, because hygiene is a personal matter. Position the patient in high folders or in a chair if possible. It is to prevent aspiration. And then, position the patient on the side if the bed cannot be elevated. If the patient is able to perform self-care, arrange supplies with the patient's reach, and assist the patient on the side with brushing and flossing as needed. For nurse, administered brushing and flossing, and place the towel across the patient's chest. Don gloves and other protective garb as needed. Next, moisten toothbrush and apply a small amount of toothpaste. Use soft toothbrush. Next, place emesis basin under the chin. Now, brush the teeth holding the bristle at 45-degree angle to the gum line. Using short circular motion, gently brush the inner and outer surfaces of the teeth from gum line to crown of each tooth. Next, brush the biting surface of the back teeth, holding the brush bristle straight up and down the teeth and brushing back and forth. Allow patient to rinse his mouth and expectorate into a Mrs. basin. Gently brush the patient's tongue. Floss the teeth. And if you're using a floss string, wrap one end of the floss around the middle finger of each hand. Stretch the floss between your thumbs and index fingers. And move floss up and down against each tooth. Floss between and around all teeth. So same as floss string, we need to floss the teeth between and around the teeth. Assist patient in rinsing mouth, or ask patient to rinse vigorously and spit water into Mrs. basin. Offer a mild or dilute mouthwash and apply lip moisturizer if desired. So this is 50% solution. 1 cup of water and 1 cup of mouthwash. Next, reposition the patient as needed. For our evaluation, inspect the teeth, gums, and mucous membrane to verify that they are free of wood particles, and then inspect for abnormalities such as bleeding. Then, observe for patient discomfort and gagging during the procedure. After that, remove gloves and perform hand hygiene. For our documentation, document the following: oral care was given, patient's response, and any abnormal findings and nursing interventions.